Hello, welcome to our general overview of the early and periodic screening, diagnosis, and treatment, otherwise known as EPSDT overview. In this webinar, you will learn about the EPSDT benefit available to eligible children under the age of 21 who are enrolled in Medicaid. Next slide. First, we will get into what EPSDT is. The early and periodic screening, diagnosis, and treatment benefit is a part of federal Medicaid law written in Section 1905 of the Social Security Act. It requires all state Medicaid programs to cover any service listed within the scope of those categories of services covered under 1905A of the Social Security Act that is medically necessary to correct or ameliorate a defect, physical or mental illness, or a condition identified by screening, whether or not the service is covered under the North Carolina Medicaid state plan. That includes any condition or illness identified through a child health screening service or encounter with a licensed practitioner. Any qualified provider operating within the scope of his or her practice, as defined by state law, can provide a periodic or interperiodic or catch-up screening. The screening need not be conducted by a Medicaid provider in order to trigger EPSDT coverage for follow-up diagnostic services and medically necessary treatment by a qualified Medicaid provider. As you will see throughout the slide deck, preventive screening visits for children may also be referred to as health check visits. They are one and the same. Another very important thing to note about EPSDT is that the services covered under EPSDT are limited to those within the scope of the categories of services listed in 1905A of the Social Security Act, and EPSDT benefits and coverage only apply to children under the age of 21 years old. Next slide. So what exactly is EPSDT? The early and periodic screening portion of EPSDT covers preventive screenings at age-appropriate intervals for Medicaid-enrolled children under the age of 21. North Carolina Medicaid follows the American Academy of Pediatrics, also known as AAP, Bright Futures periodicity schedule for preventive screenings under EPSDT. This schedule recommends 7 appointments from the time they are born until they turn 9 months old, and 5 more between the ages of 12 months old to 30 months old, and 1 appointment annually from age 3 to 21 years old. The AAP Bright Futures periodicity schedule also outlines which screening or risk assessment services should be performed for each child within that age group. Please always remember to review NC Medicaid's Health Check Program Guide for additional information about NC Medicaid's recommended screening schedule and information about billing preventive service claims for children. It's also important to note North Carolina Medicaid follows an enhanced schedule for developmental screenings, recommending these screenings be performed for children at the 6-month, 12-month, 18 or 24-month, 36 months, 48-month, and 60-month visits in addition to the developmental screening recommendations within the AAP Bright Futures periodicity schedule. If there is an indication for that child to perform a screening service at a time that is outside of what is recommended within the AAP Bright Futures periodicity schedule, those screenings can be performed and the appropriate diagnosis code should be utilized to indicate an abnormal finding. The indication should also be documented appropriately within their medical records. For instance, if a child is being seen for their 15-month preventive screening visit, and an indication is found that a lead screening should be performed, such as the parent noted lead paint found within the household, a blood lead screening should be performed, and the diagnosis within the claim should indicate the reason for that screening being performed outside of the established schedule being an abnormal finding. This should also be documented within the child's medical chart appropriately. On the diagnosis and treatment side of EPSDT, there are additional benefits available to children under the age of 21. EPSDT can help to cover the follow-up treatment needed when an illness or a condition is found. If a defect, physical or mental illness, or a condition is identified during a preventive screening, that child should be referred for follow-up care. EPSDT covers more than just preventive screenings for children. While preventive screenings are a part of what's covered under EPSDT, other medically necessary services can also be covered for that child if listed within the scope of those categories of services covered under 1905A of the Social Security Act. When an eligible Medicaid beneficiary under the age of 21 is found to need services outside the scope of what is covered within NC Medicaid's clinical coverage policies or state plan, the request can be submitted for that child and covered under EPSDT as long as it meets the federal requirements, which we will go over shortly. It is important and very helpful to include appropriate documentation to show medical necessity of the service that's being requested for this child. This requires current information from the recipient's physician, other licensed clinicians, or the requesting qualified provider. If this information is not provided, this may delay the prior authorization decision. Reviews are conducted on a case-by-case basis for EPSDT. They take into account that child's condition, comorbidities, and the medical necessity of the requested service, as well as ensuring the request meets all federal EPSDT criteria. Services covered under EPSDT are provided in the most integrated setting appropriate for the child, which includes clinics or in schools and at home, and must avoid unnecessary placements in segregated treatment settings. Next slide. On this slide, we'll provide some additional information about preventive screenings. Per the Center for Medicare and Medicaid Services, CMS, the 5 required components of an early and periodic screening encounter are comprehensive health and developmental history that assesses for both physical and mental health, as well as for substance use disorders, comprehensive unclothed physical examination, appropriate immunizations in accordance with the schedule for pediatric vaccines established by the Advisory Committee on Immunization Practices, also known as ACIP, laboratory testing, including blood lead screening appropriate for age and risk factors, and health education and anticipatory guidance for both the child and the caregiver. North Carolina Medicaid also has an oral health periodicity schedule, which can be found here. North Carolina recommends that children should be referred to a dentist by the age of 1 year old, but no later than the age of 3 years old. If screenings are missed, you should perform a catch-up or interperiodic screening for that child at their next appointment or whenever possible. NC Medicaid does not reimburse for sports physicals. Pre-participation physical evaluation should occur in conjunction with a preventive or problem-focused child health visit. Prior authorization is not required for preventive screenings. Please refer to our Health Check Program Guide for the most up-to-date billing guidance when submitting claims for preventive services. Next slide. On this slide, we'll discuss some additional information about screening and diagnostic requests. When a screening examination indicates the need for further evaluation of a child's health, the child should be appropriately referred for diagnosis or treatment without delay. These are the service requests for EPSDT services that include any medical or remedial care that is medically necessary to correct or ameliorate a defect, physical or mental illness or condition. Ameliorate means to improve or maintain the recipient's health in the best condition possible, compensate for a health problem, prevent it from worsening, or prevent the development of additional health problems. Even if the service will not cure the recipient's condition, it must be covered if the service is medically necessary to improve or maintain the recipient's overall health and the requests meet all federal criteria. This means that EPSDT covers most of the treatments a recipient under 21 years of age needs to stay as healthy as possible. And North Carolina Medicaid and all managed care organizations must arrange and provide for, either directly or through referral to appropriate agencies, organizations, or individuals, corrective treatment when the need for such treatment is identified through a child health screening service or encounter with a licensed practitioner. Next slide. As discussed previously, this slide outlines the federal requirements for the early and periodic screening, diagnosis, and treatment benefit. EPSDT services must be coverable services within the scope of those listed in 1905A of the Social Security Act. For example, rehabilitative services are a covered category of EPSDT services, even if that particular rehabilitative service requested is not listed within the Division of Health Benefits, clinical policies, or service definitions. However, habilitative services are not coverable under 1905A of the Social Security Act. The requested service must be medically necessary to correct or ameliorate a defect, physical or mental illness, or a condition diagnosed by the recipient's physician, therapist, or other licensed practitioner. By requiring coverage of services needed to correct or ameliorate a defect, physical or mental illness, or a condition or problem, EPSDT requires payment of services that are medically necessary to sustain or support rather than cure or eliminate health problems, to the extent that the service is needed to correct or ameliorate a defect, physical or mental illness, or a condition. The determination of whether a service is medically necessary for an individual child must be made on a case-by-case basis, taking into account the particular needs of that child, their diagnoses, conditions, and comorbidities. This means that services not listed within the North Carolina Medicaid state plan may be covered under EPSDT if those services are within the scope of those categories listed in 1905A of the Social Security Act, and they are determined to be medically necessary to correct or ameliorate that child's health problem. It is important to note that the service can only be covered under EPSDT if all the federal criteria specified below are met. The requested service must be determined to be medically necessary. The service must be safe. The service must be effective. The service must be generally recognized as an accepted method of medical practice or treatment, and the service must not be experimental or investigational. Next slide. This slide contains a list of all the categories of services covered under 1905A of the Social Security Act that are coverable under EPSDT. It's important to remember there is no set list of services or procedure codes that are coverable under EPSDT, as EPSDT reviews are conducted on a case-by-case basis to determine medical necessity and to ensure the requested service aligns with the federal guidelines and requirements. Next slide. In this slide, we'll review some additional information about general EPSDT benefits. It's important to remember there is no monetary cap on the total cost of EPSDT services. A child under 21 years of age who is eligible for full Medicaid is entitled to receive EPSDT services without any monetary cap, provided the service meets all EPSDT federal and medical necessity requirements. There are also no copays for beneficiaries under the age of 21 within Medicaid. If a Medicaid beneficiary or their caregiver states a barrier to care is inability to pay a copay for that child, that is not applicable, as again, children under the age of 21 are exempt from copays under North Carolina Medicaid. Non-emergency transportation, also known as NEMT, to and from medical and behavioral health appointments is also available to North Carolina Medicaid beneficiaries at no additional cost. We also included the link to our NEMT webpage within the slide deck. Next slide. So a bit of a recap on what we've already seen about EPSDT. To reiterate, children under the age of 21 are eligible for additional benefits and coverage under EPSDT federal regulations. That means that even though the service they need may not be coverable for adults or covered under the Medicaid state plan, they may still be able to receive coverage of that service if deemed medically necessary and all federal criteria is met. EPSDT covers both preventive screenings for children under 21, but also covers additional services that may be necessary to maintain a child's health or ameliorate a health problem. Next slide. Some additional information for those diagnoses and treatment service requests that fall outside of clinical coverage policy limits or are services not covered under the North Carolina Medicaid state plan. If you need to request a non-covered service for a beneficiary under the age of 21, you can submit the non-covered service request form with the prior authorization request. Please make sure to provide information about the medical necessity of that service for that beneficiary, as well as any clinical evidence for the requested service. Each request will be reviewed for medical necessity and against the EPSDT federal criteria. The managed care health plans also have a non-covered service request form on their website as well, if the beneficiary is covered by one of the managed care organizations rather than Medicaid Direct. You can find more information about how to submit requests for EPSDT services in our EPSDT Policy Instructions Guide, which is linked in the slide deck and is available on our website. Next slide. Other important facts about EPSDT. If the service, product, or procedure requires prior authorization, the fact that the recipient is under 21 years of age does not eliminate the requirement for a prior authorization. Services covered under EPSDT must be coverable within the scope of those categories of services listed in 1905A of the Social Security Act. EPSDT requires Medicaid to cover these services if they are medically necessary to correct or ameliorate a defect, physical or mental illness, or a condition. Ameliorate means to improve or maintain the recipient's health in the best condition possible, compensate for a health problem, prevent it from worsening, or prevent the development of additional health problems. Even if the service will not cure the recipient's condition, it must be covered if the service is medically necessary to improve or maintain the recipient's overall health and meets federal EPSDT requirements. Recipients under the age of 21 must be afforded access to the full array of EPSDT services covered under 1905A of the Social Security Act. Services covered under EPSDT need not be services that are covered under the North Carolina State Medicaid Plan or under any of the DHB clinical coverage policies or service definitions or billing codes. Under EPSDT, North Carolina Medicaid and the managed care organizations must make available a variety of qualified providers willing to provide EPSDT services. Next slide. Other important things to keep in mind about EPSDT coverage. When state staff or vendors review a covered state Medicaid plan service request or prior authorization or continuing authorization for an individual under 21 years of age, the reviewer will apply the EPSDT criteria to the review when it falls outside the clinical coverage policy limits, scope, and duration. This means that requests for EPSDT services do not need to be labeled as such. Any properly submitted request for services for a recipient under 21 years of age that falls outside of clinical coverage policy limits, scope, and duration is a request for EPSDT services. The decision to approve or deny the request will be based on the recipient's medical need for the service to correct or ameliorate a defect, physical or mental illness or condition. The specific coverage criteria, particular diagnoses, signs, or symptoms in the DHB clinical coverage policies or service definitions do not have to be met for recipients under the age of 21 years old if the service is medically necessary to correct or ameliorate a defect, physical or mental illness, or a condition. A child who meets EPSDT eligibility criteria is not required to have a specific diagnosis for the provision of services, as screening may identify symptoms that require attention but do not meet diagnostic criteria. This requirement may be of particular importance to children who need behavioral health services. The specific numerical limits, number of hours, number of visits, or other limitations on scope, amount, or frequency in DHB clinical coverage policies, service definitions, or billing codes do not apply to recipients under 21 years of age if more hours or visits of the requested service are medically necessary to correct or ameliorate a defect, physical or mental illness, or condition. Other restrictions in the clinical coverage policies, such as the location of the service, prohibitions on multiple services on the same day or at the same time, must also be waived under EPSDT as long as the services are medically necessary to correct or ameliorate a defect, physical or mental illness, or condition. Out-of-state services are not required to be covered if equally effective services that are medically necessary to correct or ameliorate a defect, physical or mental illness, or condition are available anywhere in the state of North Carolina. Services delivered without prior authorization will be denied. There is no retroactive prior authorization for services that require prior authorization unless there is retroactive Medicaid eligibility. DHB vendors, contractors, and MCOs must review any properly submitted request for state Medicaid plan services that fall outside the clinical policy limits, scope, and duration for a recipient under 21 years of age under EPSDT criteria when the request is made by the recipient's physician, therapist, or other licensed practitioner in accordance with the division's published policies. Next slide. Requests for prior authorization for services must be appropriately documented to show medical necessity. This requires current information from the recipient's physician, other licensed clinicians, or the requesting qualified provider. If this information is not provided, Medicaid, its vendor, or the MCO will have to obtain the necessary information, and this will delay the prior authorization decision. North Carolina Medicaid and the contracted MCOs retain the authority to determine how an identified type of equipment, therapy, or service will be met, subject to compliance with federal law, including consideration of the opinion of the treating physician and sufficient access to alternative services. Services will be provided in the most economic mode as long as the treatment made available is similarly efficacious to the service requested by the recipient's physician, therapist, or other licensed practitioner. The determination process does not delay the delivery of the needed service, and the determination does not limit the recipient's right to free choice of North Carolina Medicaid enrolled providers who provide the approved service. It is not sufficient to cover a standard lower cost service instead of a requested specialized service if the lower cost service is not equally effective in that individual's particular case. Durable medical equipment, assistive technology, orthotics, and prosthetics do not have to be included on DHB's approved lists or be covered under a CAP waiver program in order to be covered under EPSDT, subject to meeting the criteria specified in the EPSDT procedural policy instructions. DHB and the MCOs will enroll or contract with providers, set reimbursement rates, and assure the means for claims processing when the service is not already established in the North Carolina Medicaid state plan. Requests for prior authorization of services are to be decided with reasonable promptness as outlined in the section above. No properly submitted request for services for a recipient under 21 years of age will be denied formally or informally until it is evaluated under EPSDT. If services are denied, reduced, or terminated, proper written notice with appeal rights must be provided to the recipient. The notice must include the specific reasons for the intended action, citation that supports the intended action, and notice to the right of appeal. The recipient has the right to continued Medicaid payment for services currently provided, including services that received a time-limited approval through prior authorization, pending an informal and/or formal appeal. This includes the right to reinstatement of services pending appeal if there was less than a 30-day interruption before submitting a reauthorization request. Next slide. This slide discusses EPSDT coverage and participation in a Community Alternatives Program or CAP waiver. Home and community-based services, also known as HCBS, offered through waiver are available only to participants only available to participants in the CAP waiver program and are not a part of the EPSDT benefit unless the waiver service is also an EPSDT service, i.e. DME, durable medical equipment. Any request for a service coverable under Section 1905A of the Social Security Act for a CAP recipient under age 21 must be evaluated first under EPSDT and then under 1915C of the SSA if the service can't be covered under EPSDT. Additionally, a child financially eligible for Medicaid outside of the waiver is entitled to elect EPSDT services without any monetary cap instead of waiver services. Any child enrolled in a CAP waiver can receive both waiver services and EPSDT services. For individuals under the age of 21 enrolled in the 1915C HCBS waiver, services covered through the waiver are not covered under EPSDT. The cost and delivery of the waiver services must be in compliance with the coverage limitations established by the waiver application and applicable Medicaid policy. A recipient under 21 years of age on a waiting list for CAP services who is an authorized Medicaid recipient without regard to approval under a waiver is eligible for necessary EPSDT services without any waiting list being imposed by Medicaid. Next slide. Additional features of the EPSDT benefit for children. Under EPSDT, there is no waiting list for EPSDT services. EPSDT does not mean or assure that physicians and other licensed practitioners or hospitals and clinics chosen by the recipient and or his or her legal representative will not have waiting lists to schedule appointments or medical procedures. However, Medicaid cannot impose any waiting list and must provide coverage for corrective treatment for recipients under 21 years of age. There's also no monetary cap on the total cost of EPSDT services. A child under 21 years of age financially eligible for Medicaid is entitled to receive EPSDT services without any monetary cap, provided the service meets all EPSDT criteria specified in the EPSDT policy instructions document. If enrolled in a waiver program, the recipient under 21 years of age may receive both waiver and EPSDT services. However, it is important to remember that the conditions set forth in the waiver concerning the recipient's budget and continued participation in the waiver apply. There is also no upper limit on the number of hours or units under EPSDT. For clinical coverage policy limits to be exceeded, the provider's documentation must address why it is medically necessary to exceed the limits in order to correct or ameliorate a defect, physical or mental illness or condition. There is no limit on the number of EPSDT visits to a physician, therapist, dentist, or other licensed clinician. To exceed such limits, the provider's documentation must address why it is medically necessary to exceed the limits in order to correct or ameliorate a defect, physical or mental illness or condition. No set list that specifies when or what EPSDT services or equipment may be covered. Only those services within the scope of those categories listed in the federal law at 1905A of the Social Security Act can be covered under EPSDT. Next slide. There is also no copayment or other costs to the recipient. Children under the age of 21 enrolled with North Carolina Medicaid are exempt from copayment. Coverage for services that are never covered for recipients 21 years of age and older. Non-covered services may be covered under the EPSDT benefit if those services are within the scope of those listed in the federal law at 1905A of the Social Security Act. See the attached listing of services covered under 1905A, as we previously showed in the slide deck. The documentation submitted by the provider must address why the service is medically necessary to correct or ameliorate a defect, physical and mental illness or condition. Coverage for services not listed in the NC State Medicaid plan. Services not listed in the NC Medicaid state plan may be covered under EPSDT if those services are within the scope of those listed in the federal law at 1905A of the Social Security Act, and they are determined to be medically necessary to correct or ameliorate the child's health condition. Next slide. So a quick recap of the important information covered during this webinar about the early and periodic screening, diagnosis, and treatment benefit for children under the age of 21. Children enrolled in North Carolina Medicaid are eligible for coverage of additional services under the early and periodic screening benefit for children under the age of 21. EPSDT covers more than just preventive screenings for children. Children under the age of 21 enrolled in full Medicaid can also receive medically necessary services if they are coverable under the scope of those services listed within 1905A of the Social Security Act, if the service is medically necessary for that child to correct or ameliorate a condition or issue and all federal EPSDT criteria is met. Non-emergency transportation services are available at no additional cost for North Carolina Medicaid beneficiaries. There is no copay for children under the age of 21 under North Carolina Medicaid. To request a service for a child under the age of 21 that is not typically covered under the Medicaid state plan, you should submit the non-covered service request form with the prior authorization. North Carolina Medicaid follows the American Academy of Pediatrics Bright Futures periodicity schedule with enhancements for developmental screenings for children under 21. This schedule recommends 7 appointments from the time they are born until they are 9 months old, and 5 more between the ages of 12 months to 30 months old, and 1 appointment annually from age 3 to 21 years old. This schedule also provides the list of recommended screenings or risk assessments that should be performed at each visit, broken down by age group. The American Academy of Pediatrics created this evidence-based schedule to ensure that children receive the proper screenings at each age group to identify issues early, address them early, and ensure the right care to the right child at the right time. If an issue is identified, it is important to refer that child for follow-up care as soon as possible. For clinical coverage policy limits to be exceeded, the provider's documentation must address why it is medically necessary to exceed the limits in order to correct or ameliorate a defect, physical or mental illness, or condition. There's no set list of services or procedure codes that can be covered under EPSDT. Only those services within the scope of those categories listed in the federal law at 1905A of the Social Security Act can be covered under EPSDT. Next slide. So here is a list of some useful resources. These resources will provide a better understanding of how North Carolina operationalized the early and periodic screening, diagnosis, and treatment benefit for children under 21. And there are also some other resources that will help provide a better understanding of the federal requirements around EPSDT. Next slide. We will be continuing to create and post the early and periodic screening, diagnosis, and treatment trainings. So if you'd like more information on EPSDT services, please keep an eye out for the additional trainings as they are released and posted to our website. Thank you so much for watching. We appreciate you taking the time to better understand the benefits available to North Carolina Medicaid beneficiaries and learning ways to help improve their health. We hope you enjoyed this training and will return to learn more about everything available for children under EPSDT. Thank you all so much.